hard. Okay, so now supine to side lying, right? Sometimes laying on our back can be the source of pressure ulcers. You guys, in the positioning chapter, right, you read about the different effects of being in certain positions and the structures it can have. They can be susceptible to pressure ulcers. So sometimes, rather than being on your back all the time, side lying is a really good position. So in order to do side lying, you would have somebody, they would need to, we want them to be side lying in the middle of the bed, right? That's a nice safe place. So you usually have to ask them to scoot to one side of the bed or the other so that you have room for them to lie on their side in the middle of the bed. Because if they start in the middle, you roll them onto their side, then they're going to be up against those invisible bed rails again, right? And that's just not comfortable for anybody. So go ahead and scoot towards me. Yep, very good. All right, now the first thing we're going to do is I'm going to have you kind of reach over with this arm, and you're going to push with this leg over onto your side. Yep, 1, 2, 3. Now, it's usually better not to have the patient roll away from you, right? But I kind of wanted you to see what to do. So what I would be doing in that case is he's going to be away from me on that side. My hands are going to be here and here, right? And you see I have a nice deep lunge so that as he rolls, I'm able to just shift my weight back to assist him. One hand on the scapula, one hand on the pelvis. But again, who's doing most of that work? They are. Now, if I was gonna, Kelly, I'm so sorry, would you get me another pillow? No. So I wanna go over, if you have somebody in this position, on your practical, we want to leave them, we want to be leaving everybody in a safe position, okay? So for side lying, that means that we're going to put a pillow between their legs so that their hips are in a nice aligned position. Some people like, you know, a pillow like right here. If this was somebody who had a CVA, right, and this was their affected side, I would want to put a pillow at their trunk as well so that their arm was supported. Because swelling can be a problem on the affected side. And so if that arm is just down like this, then that hand and arm are likely going to, you know, swell some. So that's side lying. Now, how do you think would be the best way for me to assist somebody? They ring the bell, they're like, I am sick of side lying, right? So now I want to, again, keep the patient always going towards me rather than away from me. So if I need to switch sides for some reason, bed rails up. And you see how I'm maintaining contact on him? Just so they feel comfortable. They know that you're still there. They might feel a little bit uneasy on their side. You probably would have removed the pillows by now, right? So they're feeling a little less stable. So that's why it's good. You want to keep a hand on them as you walk around. And then you might, you're going to have them just roll back onto your back. Very good. And now we're going to scoot over. Ready? Lift up your hips. Push down with your, that way. Push down with your elbows and lift up with your hips. 1, 2, 3. Good. And then you would also assist their upper body, you know, if necessary, to make sure they're back in the center of the bed. Okay, go ahead and switch back to side lying for me so I can show them the positioning. Thanks. All right, so legs here. And then this one, you know, if you were in a hospital bed, they're a little bit bigger, so, you know, you would have more pillows on your practical. If you have somebody with a stroke, you're positioning them in side lying. I want you to use a pillow for the upper extremity. If it's not up here, oh no, like this. More like this, which is how I would like to see it in, you know, a hospital bed, but, you know, no pillow in front of their face. We're not smothering anybody, right? Just like with goniometry. So their arm would be kind of positioned like this.
And some of you yesterday, I noticed during practicals, just going to lift this a little bit, when you were having a patient in side lying, if their head is like this, you want to make sure, go ahead and relax. That's better. You know, you don't want them to develop neck pain while you're doing these other techniques. So just be conscientious of the position of their head and neck as well. So it feels a little better.
So just like this, with the arm down at the chest is fine. If there's somebody, you know, that can be our universal method. But I want to be clear that if you had somebody with a CVA, you would really want to be propping their arm up more, but not necessary for, you know, your practical. Just arm, as long as it's addressed, the legs are addressed, that's fine. Okay? So that's, oh yes, go ahead.
For this one, I saw in the book that they have it here.
And that's fine too, either way. Yeah, so if up here is what they showed you in the book for their arm, that's totally fine. I know my preference personally is like this. That's why I put everybody like that. So I think it's comfortable. Like, oh, you'll be comfortable. Right? Yeah, cuddle up. Okay, so that is supine to sideline, sideline to supine. And just remember that have them do the work. You're just assisting that segmental movement. A lot of it is pushing down with the elbows to raise up the upper trunk, to unweight it, and then using the legs to push, okay? All right, go ahead and let's have you lie back in supine. All right, so let me get this out of the way. Probably should have done that sooner. Okay, better late than never. All right, so now one of the other things that we often do, right, is supine to sitting and sitting to supine. Because usually we're not working with a ton of people like, oh, just lay in bed, right? We might do that at the end of a therapy session where we transfer them back to bed and then get them into a certain position. But oftentimes we're trying to get them sitting, right? And sometimes we do edge of bed things because, you know, you might have somebody in the ICU that's really all they can tolerate. So it's, you know, really important to know how to instruct them to sit up and to lay back down. And even though I know it seems like so obvious, right? It's nice to have a sequence to do it and make sure that you can assist them properly. So one way is that you can have the client sort of do a long sitting method. So your legs would be out straight. You're going to push up onto your elbows. So elbows behind you. Now push up onto your hands. There you go. So your hands are behind you. Now, what diagnosis do you think a technique like this would be useful for? Where he's not bending over too far. The hip, right? So you can lay back down if you want to. It's really important that you have a hand on the client's upper body because when they come up from laying down to elbows, right? Then we're going to have them come up to here. What do people want to do? They often want to just like sit way up. Well, if they've had a total hip replacement, we need to make sure that that doesn't happen. So make sure to tell them to lean back, and you're going to have a hand on their trunk to make sure that if they try to lean forward, you can kind of give them that physical pressure to stay where they are, right? And then you're going to help the client. It's usually helpful if the affected leg is, Scott, is it off first or second?
Affected leg first.
That's what I thought too, because you can guide it off easier, right? Okay, so when you're here, I'm going to have, yeah, that makes sense. I'm going to have my hand here, right, to be spotting his trunk for total hip replacement. And then this is his leg, so I'm going to actually help him. You're going to bend this knee and use it to help you pivot around to sitting. Yeah, use your legs and hands. There you go. Right, and then when I get to here, I'm going to lower that bed down. So you see I'm helping sort of support the affected leg, and I'm making sure that he doesn't lean forward too far. All right, can you scoot forward a little bit? Okay, get your feet on the ground. Perfect. So on your practical sheet where it says that you like leave the patient in a safe position, you see how I still have my hand on him? That means he's still in a safe position, right? And I'm going to say like, here's your call bell, are you okay? And then you'd be done. If your bed mobility was getting somebody from supine to sitting, that's how you would be ending, okay? Now to go from edge of bed back to supine, we're going to start here, right? The feet should always be flat on the floor. It's okay to have your client move forward. You saw his feet weren't on the floor because he was sitting too far back. So now I'm going to raise the bed up. I'm supporting his leg. Good body mechanics. Get to practice your deep squats. Okay, so now it's at a better height for me. So let's go ahead and you're going to scoot back. And I should have probably had him scoot back before I lifted up the table, so I apologize. Definitely do that first. Now you're going to bring this leg up and help pivot your leg onto the bed. Good. Now, what else with a hip replacement am I trying to prevent besides flexion? Adduction, right? So I don't want that hip to be adducting. So that's the other reason that I have my hand here on the inside, because as he brings his leg into the bed, I can make sure that it doesn't cross midline. Okay? And then what's the internal or external rotation do we want to avoid? Internal. So I can also prevent his foot from rotating in, right, with my hand in this position. Make sense? And so then I would have him go ahead and go down on your elbows. and then lay back down onto your, there you go. Excellent. Okay? Another method is to have the client get into side lying, okay, which we've already gone over, so go ahead and get into side lying. And then you're going to assist them, you're going to bring your legs off the bed and sit up with your trunk. Now, would I do this method with somebody with a total hip replacement? No. The other thing is with a total knee replacement, the method I showed you for the total hip replacement, also really effective, right? It can be really hard for them to kind of be in that position. It can feel better for you to be kind of supporting their knee as they get up. So use that same method that you did for the total hip replacement for total knee, but you're not having to worry so much about, you know, their trunk coming too far forward past 90, right? But long sitting, it might be a little uncomfortable for them. They're probably going to have their knee in a flex position because it's not often they're able to get to like extension immediately. So once we get to sitting, you're always going to want to just lower that bed to make sure their feet are flat on the floor. Okay? All right, where are we next?